but the World Health Organization, WHO, has confirmed 10 cases of polio in war-torn Syria, the first outbreak in the country in 14 years. The UN body says a further 12 cases are still being investigated. Most of the 22 people who have been tested are babies and toddlers. Before Syria's civil war began in 2011, some 95% of children were vaccinated against the disease. The UN now estimates 500,000 children have not been immunized. Polio has been largely eradicated in developed countries but remains endemic in Nigeria, Pakistan and Afghanistan. The BBC's Imogen Folks in the Swiss city of Geneva says there has been speculation that foreign groups fighting in Syria may have imported it. WHO spokesman Oliver Rosenbayer said the source of the virus had to be one of the endemic areas. That's from where it would have always spread, and that's why it is so important to eradicate in those areas, because otherwise you are going to keep seeing polio in polio-free areas, he told the BBC. Regional risk. The WHO said the suspected outbreak centers on the eastern province of Deir ez-Zor. The highly contagious disease has most often spread by consuming food or liquid contaminated with feces. Of course, this is a communicable disease. With population movements, it can travel to other areas, so the risk is high for its spread across the region. The Reuters news agency quotes Mr. Rosenbayer as saying in Geneva, "Immunizations have started in that area," he said. There are more than 100,000 children, all under age 5, now at risk of polio in Deir ez-Zor province alone, which had been caught in fierce battles between Syrian government forces and opposition fighters. The city of Deir ez-Zor remains partially controlled by forces loyal to President Bashar al-Assad, while the countryside is in the hands of the opposition. More than 4 million Syrians have been displaced internally by the conflict and generally live in overcrowded, unsanitary conditions. A further